Welcome. My name's Connie Dahlin, and I'm a consultant with the Center to Advance Palliative Care. These short pre-recorded sessions are designed to offer you quick access to information, ideas, and program tips to support you in caring for patients and families in this time of crisis. Today's topic is all in, using the full interdisciplinary team during a crisis. So, why is this important? Well, the underlying fundamental principle in palliative care is that delivery occurs by an IDT. And in conventional times, palliative care quality is predicated on the use of the IDT to provide holistic care. And this does not change in crisis because we know whether in crisis or conventional times, patients will have physical, spiritual, psychological, emotional, functional, and intellectual needs. And no one team member can attend to all these aspects of care. So we also know that by using the IDT, we're optimizing each member's function and promoting their highest scope of practice to support the work in a crisis. And we also know that the use of the IDT can help ensure team wellness and resiliency within conventional times and in crisis. So we've talked to a lot of palliative care teams around the country, and here's how we're finding that they're using the IDT. First of all of the IDT members are providing proactive and just-in-time education in advanced care planning and goals of care conversations to their colleagues. And this is in the hospital, in long-term care settings, and in clinics. We also find that they're participating in telephone triage processes, be it respiratory screening clinics, specialty care clinics, or palliative care clinics. We're seeing that administrators are really taking the time to look at all the information and synthesize it to provide regular updates to their team on critical COVID information from their organization, from the field, and from the world. This allows the clinicians to focus on the clinical care and not keep up with the constant stream of emails they're getting with updates. We're seeing that physicians and advanced practice providers are embedding themselves in the ICU and the ED to provide one point of contact. This helps with the care that patients receive because they can support their critical care and pulmonary medicine colleagues with pain and symptom management advice and also support in critical conversations. They're also providing 24/7 on-call consultation to their colleagues. This is because our colleagues have little time to put orders in the computer or to write a referral. So by having them be able to call us, they can get the information and advice that they need all at one time. And palliative care team members are providing 24/7 patient and family access by phone. This has become particularly important because we have patients who are discharged from the hospital, either being COVID positive or not, and wanting to go back to their community. However, because of the shortage of PPE in the community, we're finding that many hospices and home health agencies cannot take new patients. And so having this access to palliative care teams really is important to help them stay at home. We're also finding that social workers and nurses are performing check-in calls for patients at home. They're focusing on medications, food access, and social support with the goal of also preventing hospital readmissions. And we're also seeing nurses and social workers embedding in case management to actually provide advanced care planning and goals of care conversations to patients with serious illness, chronic illness, or multiple comorbidities. We're seeing social workers and chaplains offering supportive office hours to the palliative care team members and to the organizational colleagues so that this is a time to debrief and talk about the stress of the work, but the shared experience so that nobody is isolated. We're seeing chaplains leaving prayers via voicemail or text to patients, and patients are saying that this is so meaningful for them because they know that they were left an individualized message and they can replay it and listen to it again as they want. Chaplains are also sending texts which are uplifting to their team members to remind them that they're not alone on the front line. And volunteers are providing technology to support to patients and families in preparation of telehealth visits. And this is really important because the volunteers are actually a liaison. They're finding out what technology patients and families have or have not and letting the team know so they can help the patient and family get prepared, whether it's a telephone call and making that efficient, or helping them if it's going to be a telehealth with the information to access the platforms such as Zoom, Microsoft Teams, Blue Jeans, so that the telehealth call can be very efficient and the patient's not trying to figure out how to use the technology during the visit. And also volunteers are providing social calls to patients and families in all settings. This is so important because in this time of the pandemic, we know that there are visitor restrictions and that patients and families are isolated from each other. And so having a volunteer check in on a regular basis is so important to know that somebody's thinking of them and that they will continue to be in contact. And lastly, what we're seeing is that teams are doing daily check-ins, both to help each other understand what their responsibilities are there today, but to make sure that no one person is overloaded with work. And so by having these check-ins, they can have work reallocation. And this is really important for the team to work more efficiently together, and also to have people have regular work schedules and not have a lot of people working overtime because they've been overburdened, and other people having shorter hours because things did not turn out to be as busy for them. And lastly, we're having people look at creative IDT scheduling so that no team member works alone. This crisis has such intensity to it. And so making sure that somebody's not working in isolation and has a buddy that they can call or check in with during their work shift is just so important. So these are just some of the things that the IDTs are doing and why it's important and why we're still continuing this type of care in the crisis. So there's lots of resources on the CAPC website. If you look under the COVID-19 resources, there's a resiliency tab that looks at IDT care. There's also a Voices of the Field tab that looks at what different programs are doing. There's also a monograph for maximizing health and wellness of palliative care teams. Or you can just look at the capc.org website and look at all the tools that are available to you on the COVID-19 toolkit. So thank you for watching this video. Please take very good care. Goodbye.